Well, we're back with Wade Stiller, naturopath from the Northside Wellness Clinic over at Petrie, and we're talking about men's sexual health. Wade, what are some of the symptoms or causes of lost libido?
Lost libido is, well, the symptoms are easy, no libido. The causes, however, are many. When we talk about a lack of libido in a sexually, strictly physical sense, it's a simple loss of the desire to have sex. Most of us have heard of, our mojo, which refers more towards the psychological definition of libido, which speaks of that energy that we have that drives us to be individual and our true self, and which is uninhibited and content. To me, that's really what we're talking about when we talk about libido. It's not just the lack of desire, but there's also a lack of personal contentment that goes along with it. Plus, I like saying the word mojo, of course.
It sounds like a loss of libido is more of a job for a psychologist than a naturopath, Wade. How can supplements and other products help?
Yeah, look, Jeff, you're right. There's often an underlying emotional issue that needs to be dealt with when libido is lost long term. When it's something really chronic. Depending on what you believe about physics and biology, you may be inclined to believe that there's an absolute bond between emotional and physical health. The question really is, can correcting one always correct the other? So in looking at the way we supplement a lost libido, I'd happily recommend a product like the Health Genesis Men's Libido Booster that Pure Health Direct sell. But why I would even consider such a product is because there's herbs like ginkgo biloba and damiana in there. These are nervous system herbs, they're not specifically sexual performance herbs. So other products that support neurotransmitter production and anxiety can be useful. A good B complex, like the Nature Doc range, they have a great activated B complex. This is essential for our nervous system. So supporting healthy emotional and mental well-being is really the key to founding a healthy libido.
Okay, because I always thought that a loss of libido was just part of a sexual dysfunction. The way you're talking now makes me think that it's more of a symptom from another issue, I think.
Well, yeah, this is certainly the way I view it. As a holistic practitioner, I'm focused on working out the way all of the body systems are functioning and the imbalances that cause particular problems. The signs and symptoms our bodies display are just a way for the body to alert us of an imbalance or a deficiency. This is how I see lowered libido, especially in men. We can't ignore the probable decreases in testosterone that are associated with lowered libido, and this is something that medically can be tested and supported by supplementing. But things like depression, stress, either at work, at home, or even performance anxiety, body image issues, and other causes like abuse as a child, both emotionally and physically, they're often the real causes of lower libido. And when we start to support the body with the right building blocks, this response to the stress changes.
In what ways does that occur?
Okay, well, our autonomic nervous system, it's divided up into two different parts. Some of our listeners will be familiar with the sympathetic and parasympathetic nervous systems. When we're chronically stressed, that is when we're typically stuck in the fight and flight response. A bit like my nerves right now, actually. Our body, it stimulates and continues to run via that sympathetic nervous system. Now, when we look at what the sympathetic nervous system does to prime us for that fight and flight response, it primes us for exertion. So it increases things like more blood flow to our muscles, our skeletal muscles, so that we can be strong if we're in a fight or something. Our pupils dilate so we can potentially see better. Our sweat glands are stimulated, our heart rate and contractile strength goes up. Our digestive activity, however, decreases. The muscles in our bladder wall, they relax, so we can hold more fluid. There's nothing worse than being in a fight and having to go to the toilet. That's just not going to happen. Our bodies are really aware of that. So blood flow to our abdomen as well decreases in case of a wound or trauma. So let's face it, if we're frantically working, needing to finish by a certain time, the last thing we need to do is be going to the toilet or bother digesting food. We're too stressed. And for us blokes, the last thing we need is an erection every time we get stressed. So really our body just shuts that response down. Now, like I said earlier, if you live the same way all the time, and you basically effectively train your body to function a certain way. So all the time, when it's time to get intimate, throwing the switch from sympathetic to parasympathetic, it can be very difficult. The parasympathetic nervous system, on the other hand, it increases our digestive function, it directs blood flow to our gastrointestinal tract, it contracts the bladder, it stimulates gastric secretion, these kind of things. And to no one's surprise, of course, it increases blood flow to sexual organs and also increases sexual arousal.
Okay, so the same part of our nervous system that helps us to digest food also allows us to be sexually aroused.
You got it, after a big meal. How important is digesting food to all of us? Or actually, should I say, how many of us have digestive issues? It's probably more to the point. Yeah, look, my point is that the part of our nervous system, this part of our nervous system, it should be getting stimulated and allowed to be dominant at least a couple times a day in a healthy person. And in order for this to happen, we need to nourish it and learn to let our sympathetic response switch off.
But Wade, I'm a busy person and I have a very stressful life, I think. Well, I actually do. But so why don't I have libido issues?
Look, Jeff, this is the reason why complementary medicine is becoming so popular. Truthfully, we're all different. We all deal with stress differently, and it's this stress response that causes various symptoms in our body to occur, and these can be vastly different from one person to another, even when they're enduring exactly the same type of stress in life. Just because you are stressed doesn't mean you will have a loss of libido, but when you do lose it, I can guarantee you that you're dealing with, your stress, not properly dealing with your stress, I should say. There's some kind of stress of some kind there.
Okay, now Wade, from what I understand, the majority of our listeners are women, and if they're suffering because their partner has no libido, is there anything they can do to get things going? I mean, you've just been talking about stress, and most Australian women already do so much for their men. Is it a good idea for them to get involved in the process?
Oh, you're opening up a big can of worms now. That's a good question, Jeff. I guess there's two sides to that answer, really. Just like women who have lower libido, the last thing a man needs is to have the subject constantly brought up. It's going to cause more stress, but at the same time, if there were no women on the planet, why the heck would we even need a libido? So look, women, you guys you're really important, and we certainly need you out there. But look, getting a hold of the products that I talked about before, like the Nature Doc Activated B Complex, a good fish oil, a good quality zinc, these are all important, really, and they're not products that scream out, I'm trying to help you with your libido. These things will support the nervous system and mental function, and they'll have him coping a lot better in life. If he is open to products like Men's Libido Booster or Tester Jack, that's another one that you guys at Pure Health have there, then look, get him onto that, get him onto those as well, and the results, will be more bedroom focused.
Okay, fantastic, Wade. Well, we'll have to wrap it up there. Thank you for your time today, and we look forward to speaking to you again in the future.
No, thanks for having me. Appreciate it.
You've been listening to the Better Health program brought to you by Pure Health Direct. My name's Jeff Croucher, and we look forward to you maybe joining us. Wade's actually going to be at our office in about 15 minutes, so if you want to email him on info@Pure Health Direct or Skype him on Pure Health Direct 1, then you can do that, or in fact you can ring 1300 885 348. So thanks very much, Wade.
No problem, thanks for having me.
And what a great day.